Hey everyone, and welcome to the Deep Dive. I'm Harvey,
And I'm Donna.
and we're both seasoned MCCQE reviewers here.
That's right.
And we're on a mission to help make your exam prep just a little bit less daunting.
Exactly. We want to dive deep into all those major concepts, the ones that tend to pop up on the MCCQE.
Yeah, the ones that make you go, ooh, not this again.
Using top-notch resources like Stat Pearls will help you feel more prepared and confident.
Oh, and before we jump in, just a quick disclaimer. This is for informational purposes only.
Right.
So it's not a substitute for advice from a qualified healthcare provider.
Always consult with your doctor.
Okay, are you ready to tackle a topic that I think causes a lot of confusion for students?
I think so.
Today, we're taking on interstitial lung diseases.
ILD.
ILD. Such a mystery. Even the name itself can be a little misleading.
Yeah, how so?
Well, the sources describe it as a heterogeneous collection of distinctive lung disorders, meaning it's not just one thing.
So it's a whole bunch of different lung conditions, grouped under one umbrella term. Exactly. And to make things even trickier, the inflammation and fibrosis we see in ILD can actually extend beyond the interstitial space.
So the name isn't even entirely accurate.
You got it.
Okay, so maybe let's back up a bit then. What exactly is the interstitial space?
It's the tissue that surrounds and supports those tiny air sacs in your lungs, the ones responsible for gas exchange.
So when this tissue gets scarred or fibrotic,
It stiffens up the lung.
making it harder to breathe.
Right.
Gotcha. So when we talk about ILD, we're really talking about any condition that causes scarring in this delicate lung tissue.
Precisely. And there are so many things that can trigger this scarring process. The sources break down the causes of ILD into three main categories.
Okay, what are they?
Known causes, connective tissue diseases and vasculitides, and then there's idiopathic or primary ILD.
All right, let's break those down. What are some of the known causes of ILD?
Well, think about it. All those things you breathe in every day. Dust, fumes, chemicals. Long-term exposure to certain things can be a major culprit.
So like coal miners and black lung disease.
Exactly. And it's not just coal dust. Silica, asbestos, even organic dusts from things like mold or bird droppings can trigger ILD.
Wait, bird droppings? Seriously?
You'd be surprised. It sounds strange, but it just shows that even seemingly harmless things can be harmful to our lungs if we're exposed over long periods of time.
That's a great reminder for any aspiring doctors out there to always get a good history from their patients.
A detailed occupational and environmental history, because sometimes the cause can be something totally unexpected.
Absolutely. What about that second category? Connective tissue diseases and vasculitides.
These conditions affect the connective tissues throughout the body, the glue that holds everything together.
And because connective tissue is found in the lungs too.
These diseases can trigger ILD as part of a broader inflammatory process.
Okay, so it's not like a direct attack on the lungs, but more like collateral damage.
You could say that.
What about that third category? Idiopathic or primary ILDs?
Now this is where things get interesting. Because idiopathic basically means of unknown cause. So we're talking about ILDs that just seem to pop up without a clear external trigger.
Spontaneous combustion of the lungs.
Well, not exactly spontaneous combustion, but you get the idea. The most common type of idiopathic ILD is called idiopathic pulmonary fibrosis.
And how is that different from, say, infectious pneumonia?
Great question. With infectious pneumonia, it's a bacteria or virus attacking the lungs, right? But with idiopathic pulmonary fibrosis, it's more like the body's attacking itself, like it's mistakenly attacking the lung tissue, leading to that inflammation and scarring.
Okay. An internal battle, not an external invasion. And I noticed that there are actually 7 distinct subtypes of idiopathic ILD mentioned in the sources.
Yeah, each with its own unique characteristics, which can make diagnosis and treatment really tricky.
Like solving a medical puzzle.
With 7 different sets of pieces.
Exactly. Out of these subtypes, one that really stood out to me was sarcoidosis. What makes this one so unique?
Well, sarcoidosis isn't just confined to the lungs. It can affect many organs throughout the body.
So it's more of a systemic disorder.
Right.
With lung involvement.
Absolutely. And just like with the other idiopathic ILDs, the exact cause of sarcoidosis is still unknown. There are theories, genetic factors, environmental triggers, infections, but we don't know for sure.
A medical mystery. So if sarcoidosis can affect all these different organs, what are the signs that it's impacting the lungs?
The classic presentation is often bilateral lymphadenopathy,
Meaning?
enlarged lymph nodes in the center of the chest. And these reticular opacities, which are these fine, net-like patterns we see on imaging.
So those are red flags.
They can be, especially if we see them in a young adult.
Because sarcoidosis tends to affect that age group.
Right. But it can also impact other organs, so the symptoms can vary widely.
You keep mentioning granulomas. What are those exactly?
Think of them as tiny forts that your body builds to contain something it perceives as a threat. In sarcoidosis, these granulomas lack a specific type of central necrosis, and they're the hallmark of the disease. They can show up in the lungs, lymph nodes, skin, eyes, joints, even the heart and nervous system.
Wow, so they can be all over the place. That explains why sarcoidosis can be so tricky to diagnose and manage.
Exactly.
How do doctors even figure out what's going on?
Well, it starts with a thorough history and physical exam, of course.
Well, of course.
But often a biopsy is needed to confirm the diagnosis. Transbronchial biopsy, which takes a small tissue sample from the lungs, has a high yield in confirming sarcoidosis.
So it's like getting a peek under the microscope to see those granulomas. What about treatment? Is there a cure? Or is it more about managing the symptoms?
Well, the good news is that not all cases of sarcoidosis actually require treatment. Asymptomatic pulmonary sarcoidosis can often resolve on its own, without any intervention.
But for those who do experience symptoms, what are the go-to treatment options?
Often, corticosteroids are the first line of defense. They work by suppressing the immune system to reduce inflammation.
Corticosteroids, powerful drugs. Any alternatives for those who can't tolerate them?
There are other immunosuppressant medications, methotrexate, azathioprine, even newer biologic agents like infliximab. These can help control the disease and potentially reduce the need for long-term steroid use.
Which, as you said, can have side effects.
Right.
So managing sarcoidosis is all about finding that balance.
Between controlling the inflammation and minimizing the risks.
Exactly. Okay, so we've explored this one example of the many different types of ILDs out there. But before we move on to diagnosis and management, I'm curious about the overall prevalence and prognosis of ILD. How common are these conditions? And how do they typically progress?
That's a great question, and it seems like we might have underestimated the prevalence of ILD in the past. The sources suggest that the estimated incidence is about 30 per 100,000 people per year, but that's probably a low estimate because of underdiagnosis.
So ILD might be more common than we think. What about prognosis?
Well, as you can imagine with such a diverse group of disorders, the prognosis varies quite a bit. It really depends on the specific type of ILD, how severe the disease is, and how early it's diagnosed and treated. Some subtypes respond well to treatment and have a pretty good prognosis.
Like which ones?
Some of the ones listed include acute eosinophilic pneumonia, cellular interstitial pneumonia, BOOP, lymphocytic interstitial pneumonitis, pulmonary capillaritis, granulomatous interstitial pneumonitis, and alveolar proteinosis. But even with those, early intervention is key.
So early diagnosis and treatment are crucial, just like with most medical conditions. What about the subtypes that are more resistant to therapy?
Unfortunately, some ILD subtypes, especially those that have progressed to more advanced stages, don't have as favorable a prognosis. Idiopathic pulmonary fibrosis, for example, which we talked about earlier, is one of the more challenging ones to treat effectively.
Idiopathic pulmonary fibrosis, that's tough. The most common type of idiopathic ILD is also one of the most difficult to manage.
It is, and it just goes to show why ongoing research and the development of new treatments are so important in the fight against ILD.
Okay. We've covered the different causes of ILD, the complexities of sarcoidosis, and the variable prognosis depending on the subtype. I think we're ready to dive into the nitty-gritty of evaluation and management. What's the first step in figuring out if someone has ILD?
It all starts with a thorough patient history, gathering all the clues we can. Their symptoms, potential exposures, medical history, family history. It's like putting a puzzle together.
What comes after the history?
The physical exam. We listen to their lungs, check their oxygen levels, look for any signs that might point to ILD, like clubbing of the finger.
Clubbing of the fingers. How does that relate to lung disease?
It can be a sign of chronic low oxygen levels, which can happen with severe lung diseases. After the history and physical, we'll order some lab tests.
Blood tests. What can those tell us?
They can help us rule out other conditions, check for inflammation, even look for markers of specific ILD subtypes.
So it's not just about confirming ILD, but also getting a clearer picture of what type it is. What about imaging?
Imaging is definitely key. We'll usually start with a chest x-ray.
But can a regular x-ray really show us those subtle details of fibrosis and inflammation?
That's where the high-resolution CT scans, or HRCTs, come in. Those give us a much more detailed view of the lung tissue.
So the HRCT is like using a magnifying glass.
Exactly. It helps us assess the extent and pattern of the fibrosis. Oh, and it's important to note that these scans should be done with the patient lying flat on their back. The research emphasizes that.
To get the most accurate images possible.
Right.
Okay. History, physical exam, blood tests, imaging. What about pulmonary function tests?
PFTs are definitely a vital part of the ILD evaluation. They measure things like lung volume, airflow, and gas exchange.
So that we can see how well the lungs are working.
Right. Sometimes we might also recommend a bronchoalveolar lavage, or BAL.
A BAL.
It's basically a tiny scope that goes down into the lungs to collect some fluid.
Sounds a bit invasive.
It's not as bad as it sounds. While it's not specific for any particular ILD type, it can help us narrow down the possibilities by looking at the types of cells present in the lungs.
I see. And what about a lung biopsy? Is that ever necessary?
Sometimes it can be helpful in certain cases, particularly in diagnosing sarcoidosis and idiopathic interstitial pneumonia.
Okay. So we've covered a lot on the evaluation side of things. What about management? How do doctors approach treating ILD?
Well, the management of ILD is as diverse as the conditions themselves. It depends on the specific subtype, the severity of the disease, and the patient's overall health.
No one-size-fits-all approach.
Exactly. But there are some general principles that apply to many cases. For ILD caused by environmental or occupational exposures, the most important step is avoidance.
If you know what's causing the problem, get away from it. Makes sense.
Absolutely. Other general supportive measures include smoking cessation, pulmonary rehabilitation to improve lung function, and supplemental oxygen if needed.
Those are more about improving quality of life.
Right. Now, when it comes to specific treatments for the different types of ILD, things get more nuanced. For idiopathic interstitial pneumonia, corticosteroids and immunosuppressive therapies are often the mainstays of treatment.
We talked about this earlier. They help calm down the immune system and reduce inflammation.
Right. But these medications can have side effects, so they're not right for every patient.
Always weighing the benefits and risks. Are there any other medications specifically for ILD?
There are a couple of drugs, nintedanib and pirfenidone, that are approved for treating idiopathic pulmonary fibrosis.
Do they actually reverse the fibrosis?
Not quite. Nintedanib has been shown to slow down the progression, but it doesn't reverse the scarring that's already there.
So it's more about buying time, preventing further damage.
Exactly, and that's why early diagnosis and treatment are so important.
I imagine that in advanced cases, medication alone might not be enough.
You're right. In end-stage lung disease, lung transplantation might be considered.
Wow, lung transplantation. That's a major procedure.
It is a complex and risky surgery, but it can be a life-saving option for those who have exhausted all other treatment avenues.
Okay, so we've gone through a whirlwind tour of ILD evaluation and management.
We've covered a lot of ground,
It is a lot to take in.
but hopefully you have a clearer understanding now of how complex ILD is.
Absolutely. And remember, this is just a starting point. We encourage you to look deeper into the source material and explore other resources.
Right. And just to reiterate, the information we've discussed is not a substitute for professional medical advice.
Absolutely. Consult with a qualified healthcare provider.
Always.
And we'll be back with part 2 to explore even more about this challenging topic. Stay tuned.
See you then. You know, as we've been talking about all these intricate details of ILD, I can't help but think about the challenges doctors face in the real world.
Yeah, it's one thing to read about it in a textbook, but it's quite another to actually apply that knowledge to real patients.
Exactly, and I think the sources do a good job of highlighting how tricky it can be to pinpoint the exact ILD subtype, especially early on.
It's like solving a medical mystery with all the clues jumbled up.
That's a great analogy. The sources mention that dyspnea is often the first noticeable sign of ILD.
Dyspnea, that's shortness of breath. Right?
Right, but of course shortness of breath is a symptom of so many things, not just ILD.
So how do doctors figure out what's causing it? Is it ILD or something else, like asthma or even heart problems?
It really is like detective work. You have to consider the whole picture. The patient's medical history, their exposures to different things at work or in the environment, their medications.
Like medications can cause ILD?
Oh yeah, some drugs can actually trigger it, believe it or not.
Wow, I had no idea. It really shows you how important it is to look at everything when you're trying to diagnose these conditions.
Absolutely. And speaking of diagnosis, the sources really stress the importance of high-resolution CT scans those
I talked
HRCTs.
about those earlier, right? They're like getting a high-definition picture of the lungs.
Exactly. But even with those, sometimes the diagnosis isn't clear-cut.
You mean the images might look similar to other interstitial lung diseases?
Right, and in those cases, you might need to do a lung biopsy to get a definitive answer.
It's like calling in the forensic experts when the initial evidence isn't enough.
I like that. And even once you have a diagnosis, managing ILD can be really challenging.
Because the different subtypes can act so differently.
Exactly. Some respond well to treatment and have a good prognosis. Others are more aggressive and tend to progress much faster.
So catching ILD early and starting treatment is crucial.
Absolutely. The earlier you intervene, the better the chances of slowing down the disease and preventing further damage to those delicate lungs.
It's like a race against time.
I like that analogy. And just like in any race, having the right tools and strategies is essential. In this case, it means using a combination of medications, lifestyle changes, and supportive therapies.
It's about more than just medication, though, right?
Oh, for sure. It's about empowering patients to take an active role in managing their condition.
Things like quitting smoking, pulmonary rehabilitation to improve lung function.
Exactly. And even making sure they get enough rest can make a huge difference.
It's about taking a holistic approach to ILD and helping patients feel more in control of their health.
Absolutely. And that's where a strong patient-doctor relationship is so important. Doctors need to be not just skilled clinicians, but also compassionate guides. They need to walk alongside their patients, offering support and encouragement every step of the way.
It's about fostering hope, even when dealing with a disease like ILD that can be so unpredictable.
Exactly. Speaking of understanding, I think it's important to acknowledge the mental and emotional toll that ILD can take on patients.
Right. It's not just a physical disease, it affects their whole lives.
Exactly. Receiving a diagnosis of ILD can be incredibly scary for people. It can trigger anxiety, fear, even depression.
I can imagine. Facing a chronic lung condition with an uncertain future is incredibly daunting.
And the physical limitations, the shortness of breath, fatigue can further contribute to feelings of isolation and hopelessness.
So doctors need to address the emotional and social impact of ILD, not just the physical symptoms.
Absolutely. It's about recognizing that there's a human being behind every diagnosis, a person with fears, hopes, and dreams.
Are there any specific strategies or therapies that can help people cope with the emotional burden of ILD?
There are a number of things that can be helpful. Cognitive behavioral therapy, or CBT, can help people manage their anxiety and improve their mood. Support groups provide a safe space for patients to connect with others going through similar challenges. Even mindfulness techniques like meditation or deep breathing can be beneficial.
So it's not just about medications and medical procedures.
Not at all. These non-medical interventions can play a huge role in a patient's overall well-being.
It really highlights the importance of taking a holistic approach to healthcare.
Treating the whole person, not just the disease. And that brings us to another crucial aspect of ILD management, the importance of a strong healthcare team.
We touched on that earlier, right?
It really does take a village to care for patients with ILD. The sources emphasize the need for a collaborative approach involving pulmonologists, nurses, respiratory therapists, pharmacists, and social workers.
It's like a well-coordinated symphony, with everyone playing their part to create a beautiful and harmonious whole.
I love that analogy. Pulmonologists are the lung experts. They diagnose and treat ILD and guide the overall care plan. Nurses are the frontline heroes, providing hands-on care, administering medications, monitoring vital signs, and educating patients.
They're the ones who are there day in and day out, providing comfort and support.
Exactly. Then we have respiratory therapists who are crucial for managing breathing problems. They provide oxygen therapy and teach patients breathing techniques to improve their lung function. Pharmacists ensure that patients are on the right medications at the correct doses and monitor for side effects.
They're like the medication guardians, making sure everything is running smoothly.
Exactly. And last but not least, we have social workers who provide invaluable support by addressing the social and emotional aspects of ILD. They help patients navigate the healthcare system, connect them with support groups and resources, and offer counseling.
They're the ones who help patients deal with the non-medical challenges of living with ILD.
Absolutely. When all these healthcare professionals work together effectively, it creates a truly patient-centered approach that addresses all aspects of ILD.
It's a powerful reminder that teamwork makes a world of difference.
Well said. Speaking of understanding, I think it's worth revisiting the epidemiology of ILD. We talked earlier about how it might be more common than we previously thought.
Right. The sources mentioned an estimated incidence of around 30 per 100,000 people, but they suggested that's likely an underestimate.
Yeah, because of underdiagnosis. And I think that highlights an important point. We need to do a better job of raising awareness about ILD among both doctors and the general public.
So that people can recognize the early warning signs and seek medical attention sooner.
Exactly. Sometimes those early symptoms of ILD can be subtle and mimic other respiratory conditions.
So people might just brush it off as a cold or the flu.
Exactly. Or even if they suspect something more serious, it can be challenging to get a timely and accurate diagnosis.
Because it can be tricky to distinguish between the different subtypes.
Right. And there's another factor that can contribute to misdiagnoses. The sources mention that ILD is often associated with older age.
So the symptoms might get dismissed as just a normal part of aging.
Unfortunately, that does happen sometimes. But it's crucial to remember that age alone should never be a reason to rule out ILD. Any new or worsening respiratory symptoms in older adults should be taken seriously and evaluated thoroughly.
We can't just assume it's just part of getting older.
Absolutely not. Just like with any other medical condition, early diagnosis is key for ILD.
So what can we do to raise awareness and improve diagnostic accuracy?
That's a great question. I think it starts with education. We need to educate both doctors and the public about the different types of ILD, the early warning signs, and the importance of seeking medical attention promptly.
And making sure that people have access to specialized care and advanced diagnostic tools no matter where they live.
Exactly. It's about ensuring that everyone has the chance to breathe easy and live a healthy life.
Well said. We've covered a lot of ground in this part of our deep dive into ILD. We've talked about the challenges of diagnosis, the importance of a holistic approach to care, and the crucial role of the entire healthcare team.
We've also highlighted the importance of communication and collaboration in bridging the gap between medical expertise and patient understanding. And we've touched on the critical need to raise awareness and improve diagnostic accuracy so that everyone has the chance to receive timely and appropriate treatment.
This deep dive has definitely given us a lot to think about, and we hope it's inspired you to continue exploring the fascinating world of medicine with curiosity and compassion.
There's still so much more to learn about ILD, but for now, we're going to take a short break. We'll be back soon with the final part of our deep dive, where we'll delve into some of the cutting-edge research and future directions in the field. Welcome back to our deep dive into ILD. You know, one thing that really stood out to me from the sources was how they emphasized the importance of clear communication when it comes to these conditions.
Right. All that medical jargon can be overwhelming, even for us healthcare professionals sometimes.
Exactly. And for patients, it can be incredibly confusing and even intimidating.
Absolutely. We need to make sure we're not just throwing medical terms around without explaining what they mean. It's about meeting patients where they are and using language they can understand.
I couldn't agree more. It's about building trust and rapport with our patients so they feel comfortable asking questions and being active participants in their care.
It's a partnership, not a dictatorship.
Exactly. And I think that starts with acknowledging that we don't have all the answers. Medicine is constantly evolving, and there's always more to learn, especially when it comes to something as complex as ILD.
Humility is so important in medicine. We need to be willing to admit when we don't know something and be open to learning from our patients and from each other.
I completely agree. That open-mindedness and willingness to collaborate is what drives progress in medicine.
Speaking of progress, I'm curious about the future of ILD research. What are some of the most promising areas of investigation that could lead to new treatments or even a cure?
Well, there's a lot of exciting research happening right now. One area that's generating a lot of buzz is the development of antifibrotic drugs.
Antifibrotic drugs, what are those?
They're medications designed to target the scarring process directly.
So they could actually reverse the damage that's already been done to the lungs.
That's the hope. The idea is to stop or even reverse the formation of that fibrous tissue.
Wow, that would be a game changer for patients with ILD. What about gene therapy? I've heard that's showing promise for other diseases.
Gene therapy is definitely an exciting field with a lot of potential for ILD. Scientists are working hard to map the genetic underpinnings of these conditions. They're trying to identify specific genes that increase the risk of developing ILD.
So it's like creating a genetic roadmap of the disease.
Exactly. And once we understand the genetic factors better, we can start developing targeted therapies that address the root cause of the problem.
It's like personalized medicine for ILD, tailoring treatments to an individual's unique genetic makeup.
That's the goal. And then we have stem cell therapy, which is another area with huge potential.
Stem cells, how would those be used for ILD?
Stem cells have the amazing ability to transform into different types of cells, so the idea is to use them to repair or replace damaged lung tissue.
It's like giving the lungs a second chance.
Exactly. It's still early days for stem cell therapy, but the possibilities are incredibly exciting.
It sounds like the future of ILD research is full of hope.
It definitely is. With brilliant minds all over the world working on this problem, I'm confident we'll continue to see incredible advances in the years to come.
That's a great message to leave our listeners with. Hope. Even in the face of a challenging disease like ILD, there's always reason to be optimistic about the future.
Absolutely. And that hope is what motivates us as healthcare providers to keep learning, keep asking questions, and keep striving to provide the best possible care for our patients.
Well said. I think we've covered a lot of ground in this deep dive into ILD. We've explored the different types, the challenges of diagnosis and management, the latest research, and most importantly, the human side of this disease.
We've also emphasized the importance of clear communication, a holistic approach to care, and the power of teamwork in providing the best possible outcomes for our patients.
This deep dive has been a great learning experience for us, and we hope it's been informative and inspiring for you too.
Remember, this is just the beginning of your journey into the world of ILD. Keep learning, keep exploring, and never lose sight of the human beings at the heart of everything we do in medicine.
Thank you for joining us on this deep dive. We'll be back soon with another fascinating medical topic, so stay tuned.
Until next time, happy studying.